Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So today I'm going to talk you through what happens at your coil fitting procedure. Now, you may be having a coil fitting, for example, as part of HRT. You may be using it for contraception. You may be using it for pain, for example, with endometriosis, or you may be using it for heavy periods. And I'm going to talk you through what happens at that procedure. So the first thing to say is it's really important you have the ability to discuss with your doctor first or your healthcare professional about the procedure. Talk through all the risks and benefits and talk through what is entailed in that procedure. The reason that's so important is for some women, it can be very uncomfortable, or obviously the unknown, just not knowing, can be really scary. So it's making sure we alleviate all of those worries and talk through actually what happens so you feel more in control. The second reason is for some women, having a procedure, having the speculum or an examination can be excruciating for a number of reasons. So I use a procedure appointment as a way of discussing, is there something else we can do? For example, using estrogens, topical estrogens, or using moisturizers for a couple of months beforehand to make the procedure a lot more comfortable. The other reason you want to use it as a way of consenting the patient and going through all those risk benefits, but also if you are using it for contraception, making sure that when you come to the procedure time, there's no chance of getting pregnant. And by doing that, we will discuss what options, be it using a extra bit of contraception, making sure if you've already got a coil and it's an exchange, that it's within the exchange date that it should be, or giving you that overlapping contraception, or of course abstaining and making sure you're not having any intercourse, because we don't want, if there's a pregnancy already in there, we don't want to be putting a coil in. So the other thing is, if people are scared, then not only do we want to talk through the questions, but just talk through what things you can do at your procedure. So I always encourage people, bring music if it makes you feel more relaxed. Bring someone's hand to hold. And of course, at the procedure, we can do things like dim the lights, because we'll have a light that goes directly looking anyway, and just do anything that makes you more comfortable. Okay, so that's the kind of procedure. Then at the procedure, what will happen? Obviously, you'll sit down, talk through, sign a consent form potentially if you haven't already done so, and then be asked to go and lie on the medical couch. When you do that, hopefully someone will give you something to cover your bottom half, and you will take everything off under to your knickers. And most people will have already experienced having the actual examination before and having a speculum before, because you may have had your cervical screening test or needed it if you've had any bleeding or discharge that needed swabs doing. But what happens is you will lie down, and actually some people have stirrups, which is where you put your legs into these little arms that hold your legs. But actually, I find it a lot nicer for women just to ask women to put their feet together, keeping your feet on the bed and flopping your knees out. And then hopefully you can rest one knee on a wall or something to give you that more control. Then what will happen is we will examine you, and I've kind of put my two models here together so you can see what we're seeing from the outside. This is your womb here. This goes down from your cervix into your vagina, and then your vulva is on the outside of what we will see. So this is what I will be seeing from this end. So I will just check and make sure everything looks okay. And then we do the procedure, talking you through it if you would like as we go along, making sure you understand what's happening and you're, again, in control. My default is always a small speculum. If you've watched all my videos, you will see that, me talking about that, and lots of water-based lubricant. Of course, actually, if you're not having your cervical screening at the time and we're just doing an examination or your coil fitting, feel free to bring your own lubricant that you find helpful, but it doesn't have to be water-based in that case. You can even have, for example, you could use the double glide effect, which we talk about in when you have sex, about making it less frictionless or less painful. And what that would mean is, for example, I use a lubricant on the instruments, and you may have already moisturized or put like an oil-based lubricant on your vulva to try and help it be a lot more comfortable. So lots of lubricant. And then what we were doing is we are doing this, a little bit difficult to show you because I've also got a womb sitting behind this model, but normally I would show you with just the vulva, and you open the speculum out, and then I can look inside and I will see the cervix there. I will see the neck of the womb. So I've put my speculum in, at which point then I'm going to be able to see through here, my speculum, I'm going to see your cervix. So the entrance to the womb, because where your coil is sitting is in the womb. So next what we'll do is offer you some pain relief. There's different forms in the forms of a spray, and xylocaine spray, lidocaine spray. There is some actual liquid you can put into there, which actually there's not much evidence for, but a lot of women it does help because it kind of relieves the pressure because they've already had it, the cervix kind of opened, and then liquid going in acts as a lubricant. There is obviously some anaesthetic effect there. You may be offered something called a cervical block, which is where you actually inject anaesthetic into areas around the cervix to try and help with the pain relief there. So lots of different ways of pain relief. Then when it comes to the actual fitting of the coil, we use this little instrument, and what happens is this then goes, everything being talked through, making sure you're still comfortable. From our speculum will be sitting there, we go in here, into the womb, and then what happens is we would have measured first, making sure that the womb is the correct, our little instrument here is at the correct length so that we don't go through the other side of the womb. But what we do is we measure it gently, and then we will put this according to where our measurement is so that it stops it then at your cervix, so you can't go any further. And then what we do is we just release this coil into the womb. And this is my demonstration one, so it's a little bit more trickier, I'm afraid. But what happens is you put that there and you release it, and you can see it's gone from basically the arms were together where you try and measure it, and then when you release it, these arms come apart, and then it just sits at the top of your womb. And then what happens is these strings, so this is very useful for you to know, this is the vagina. I try and cut the strings quite short so that if you're having intercourse, you don't feel the prodding and your partner doesn't feel it. And then I cut the strings here short, and then this instrument just gets taken out. So all you get left with then is you will have these little strings sticking down here. It's a bit difficult to see on the camera, but basically I'm just showing you the end of where these strings sit. So that's your vagina. This is your vulva, so you won't see it on the outside. But what we say is around 12 weeks, just check your threads. And to do that, squat down deep, put your finger as far in as you can feel, and right at the top, when you go through your vulva, right at the top, you will just feel these little threads, little metal threads poking here, just up here. And that's it. You should be able to feel them. If you can't feel them, please go and get an examination, because what can happen is that actually it's a guesstimate of how far you're going. You're trying to not go through the womb, so it's a guesstimate. So what can sometimes happen, it sits a little bit down and then it moves up, and then obviously your strings go up and then you can't feel them. So that's a possibility. The other reason to get checked out is because of that rare risk, which I've talked about in another video of the risks of and benefits of having coils. There is always a risk of, because it's a blind procedure, of sometimes going through the womb, which then ends up in your tummy. So if you can't feel your threads, there is a chance then the coil is in your tummy. So it's important you get examined, because if you then don't get, the strings aren't seen, you can be sent for an ultrasound. Now that's not to panic you at the end of this video, it's just making sure that we're safe and that I've covered everything, including the after when you will feel your strings. So that was a kind of brief lowdown of how you have your procedure, and I hope that was helpful.